FMA is a 5-domain assessment that evaluates and measures recovery in post-stroke hemiplegic clients. It is commonly used in research settings, and it is one of the most widely used quantitative measures of motor impairment. The FMA has 5 domains, including motor function, sensory function, balance, joint range of motion, and joint pain. The FMA includes an upper extremity and lower extremity portion of the assessment. As OTs, we would only perform the upper extremity portion. It is unlikely that we would see an OT perform this entire assessment in any setting. As OTs, we have many more formal and informal assessments to assess these 5 domains in a much more timely and effective manner. Areas of assessment include ADLs, functional mobility, and pain. Assessment involves observing the client. Administration mode is paper and pencil. The cost is free besides the equipment required, and time to administer is about 30 minutes. Modified versions exist, and subscales may be individually administered. You will need a tennis ball, a small cylindrical container, a tool to administer reflex tests, a pencil or pen, a cotton ball, a piece of paper, a chair, and a table. The ideal environment will involve space for the client to move around and a quiet area with limited distractions. The FMA is used with those who have had a stroke, and this may include anyone who is 13 years or older. When administrating, give clear and concise instructions with demonstration and verbal cues as needed. Perform movement with unaffected extremity first. Perform each movement 3 times on the affected side and score the best performance. Do not assist the client. Test wrist and hand function independently of the arm. For example, provide support under the elbow during wrist assessment. Okay, so we're going to do the Fugl-Meyer assessment, the upper extremity portion. All right, say hi to the camera. Okay, so first we're gonna do the reflex activity section, and this will include testing the biceps and the triceps. So you'll start with the unaffected side first. So rest. Okay, good. And then you'll do the affected side. Okay, you can move your arm over here. Okay, good. You can see. All right, for the next part, you'll be testing the volitional movement within synergy section. And this section will involve the client touching their knee with their right hand to the ipsilateral ear. So right knee to left ear. Okay, so can you do that 3 times? With your right hand, touch your right knee to your left ear. Yep, and then 2 more times. Okay, good. All right, so the next section will be testing the extensor synergy. So this one, the client will start touching their ear and then to their knee 3 times. Okay, so can you use your right hand to touch your left ear to your right knee? Right here. Yep, okay. So then one more time. Good. So the next section is the movement combining synergies section, and the first task in this section is hand to lumbar spine. So the client will use their right or their affected side to touch their back 3 times with their hand. Okay, so can you use your right hand to touch your back 3 times? And then back to your knee. Yeah, and then back again. Back. And then one more time. Good. Okay. Task. The next task of this section is the shoulder flexion to 90 degrees and elbow at 0 degrees. So the client will flex their elbow to 90 degrees 3 times on their affected side. Okay, so can you bring your shoulder like this with your elbow straight?
The other hand?
Nope, this one's good. Okay, and then back down, and then one more time. Okay, good. Okay, so the third section is the pronation, supination of forearm, elbow at 90, and shoulder at 0. So for this section, the client will have their elbow at 90 and they will be supinating and pronating. Okay, so can you keep your elbow bent? Right, you can keep it next to your side. Sorry. Yeah, there you go. And then with your palm down, out in front of you. Out here. There we go. And then off of your lap. Can you bring it up? This one? Like off your lap? There you go. So just move your hand over like that. Okay, good. And then 2 more times. Okay. Looks good. Okay, so the next section is movement out of synergy. So the first task of this section is shoulder abduction to 90, elbow at 0, and forearm pronated. So the client will do this with their affected side. So can you move your arm out like this, over this way? There we go, and then back down, and then up again. Okay, good. And then back down and up. Okay, good. So the next section for this section is pronation, supination of forearm, elbow at 0, and shoulder at 30 to 90 degrees of flexion. Okay, so can I have you bring your shoulder up a little bit with your elbow straight? Oh, you can leave it on your lap. There you go. And then can you turn your palm up like that? And then back down, and then up, down, up, down. Okay, good. The next section of the test is the wrist section. So this will start with the client sitting with elbow at 90 and shoulder at 0. So I'll have you extend your wrist as far as you can. So can you move your wrist back this way? As far as you can? Like that, okay. And then can you do that? Okay, good. Okay, so the next section is flexion, extension, elbow at 90, and shoulder at 0. And in this section, the client will be moving their wrist in extension to flexion 3 times. Okay, go ahead. So this way to this way, back and forth. Okay, good. Okay, so the next section is the same thing, except for the client will have their shoulder flexed 30 degrees. Okay, so back. There you go. So back this way. Okay, good. Okay, so the next section is circumduction, and the client is sitting with arm at side, elbow flexed to 90, and forearm pronated. Okay, so can you do this movement with your wrist? Okay, looks good. The next section of the assessment is the hand. So the first 2 sections are finger mass flexion and finger mass extension, and each one will be done 3 times. Okay, so can you start with your hand like this? And can you make a fist? Open, close, open, close. And then the next, can you start with your fist? Can you start like this? Okay, and then open, close, open, close, open, close. So the next section are the grasps. So the first grasp section involves the client using a hook grasp. So you'll tell the client, pretend you are holding the handle of a briefcase, and then pull. Okay, good. Okay, so the next section is the second grasp, and this will be using a piece of paper. Okay, so can you take this piece with your right hand like before? Okay, here, let's put it. Can you put it? Okay, and I'm gonna pull really hard. I'm gonna pull on it really hard, so hold on tight. Okay? Good. Hold on. Okay, so the next section is grasp 3, and this involves the client picking up a pencil from the table and using their thumb and index finger, and then the therapist will hold the top and provide resistance. Okay, so can you pick up the pen with your thumb and your index finger? Okay, and then can you hold it like this? Okay, and then I'm gonna pull from this end, so hold on tight. Oh my god. Okay. Okay, so the next section is grasp 4. So the client will pick up a small can, and they will pick it up from the table, and then the therapist will provide resistance by giving a slight tug. Okay, so can you grab that? Okay. Okay, and then I'm gonna try to pull it out from your hand, okay? No. No. Okay, hold tight. Here. Okay, and then hold tight. Good. Okay, so the last section of the grasp, the client will grab a tennis ball from the table, and then the therapist will try to pull it out. Okay. You're ready. All right, and then lift it up. Okay, and then I'm gonna pull. So hold on tight. Good. Okay, so the last section, so the next section is the coordination speed section. So the client will be sitting and they will bring their finger from their knee to their nose 5 times as fast as they can. Okay, so can you use your right hand to bring your finger from your knee to your nose? Fast as you can. 2, 3, 4, 5. Okay, stop. Okay, so the next portion of the assessment is the sensory assessment, and this will include light touch using a cotton ball. So you're going to tell the client, I'm going to touch you with this cotton ball, and I would like you to tell me if you can feel that you are being touched. So you'll start on the unaffected side. So can you feel this?
Yeah.
Okay.
You look handsome as ever.
Alright, so I'm going to have you close your eyes.
Handsome as ever.
Then I'm going to touch you with the cotton ball on your left side, and then I'll touch your right side, and I'm going to ask you if you can feel them each time. Okay? Alright, so close your eyes. Can you feel this? Close your eyes. Can you feel this? Can you feel this? Close your eyes.
Keep them.
Close your eyes. Can you feel this? Okay. Can you flip your hand over? Close your eyes. Can you feel this? Flip this over. Can you feel that? The next section of the assessment is the proprioception section. So you will have the client be sitting or supine and test the upper extremity. So start with the unaffected limb, and you'll explain to the patient with their eyes open, I'm going to move your arm, and then demonstrate. This is up, and this is down. And then tell them, I want you to close your eyes and tell me if I am moving you up or down. Alright, so close your eyes. Up or down? Close your eyes. Up or down? Up or down? Up or down? Okay. Alright, and then next you will do elbow flexion. Okay, so close your eyes. So this is up and this is down. Alright, now close your eyes and I'm going to ask you. Up or down? Okay. Up or down? Up or down? Up or down? Okay. Up or down? Okay. The next sections will be with the wrist and the thumb. Okay. So I'm gonna move your wrist. Close your eyes. This is up and this is down. Right now I'm gonna ask you. Up or down? Up or down?
Down.
Up or down? Up or down?
Down.
Okay, good. Okay, so I'm gonna move your thumb next. So this is up, this is down. All right, now close your eyes. Close your eyes.
Rock.
Can you close your eyes? Okay. Up or down? Up or down?
Down.
Up or down? Up or down? Overall, the FMA upper extremity assessment includes the following sections: upper extremity, wrist, hand, coordination and speed, sensation, passive joint motion, and joint pain. In my video, parts A through H were administered. The motor function total score only includes sections A through D, while the other sections are left as separate scores. The passive joint motion and joint pain sections include movements of the shoulder, elbow, forearm, wrist, and fingers. At the same time, level of pain during each movement should be recorded on the scoring sheet. Here's the scoring sheet for the upper extremity portion of the assessment. To the left are the descriptions of each part of the assessment, and to the right are the scores in which you would circle following each test. Each section is slightly different in terms of scoring. If administering this assessment, you may want to have the manual nearby when scoring for detailed instructions. On the last page, you can record each score for each individual section. A, B, C, and D go into the total for motor function, while H and J are separate scores. The FMA was found to have excellent intra-rater reliability, inter-rater reliability, internal consistency, and construct validity. Both the content validity and face validity were found to be very good. Here is a chart that summarizes normative information regarding the scores of the FMA. The MDC of the upper extremity portion was 5.2. The MCID was found to have a 1.5 change at discharge. It was also found for the grasping ability, releasing ability, ability to move the arm, ability to perform the COPM, and overall upper extremity function. The FMA is only available in English and French versions. It should not be completed with clients who need a proxy. It only assesses gross limb movements, and it has the potential to separate motor recovery from functional recovery. Give clear and simple directions during the assessment, as the client may have cognitive impairments or hearing impairments. In an article by Sullivan et al., the following conclusions were made. The FMA has a well-established reliability and validity. Greater motor severity is correlated with lower functional ability. The psychometrics of the sensory domain are less robust. The FMA is a valid and reliable measure of post-stroke motor impairment severity. The FMA was developed from the original stages of motor recovery by Brunstrom, and lower FMA scores indicate greater impairment. In an article by Fugl et al., the following conclusions were made. The FMA, shortened version, has a better concurrent and predictive validity compared to the streamlined Wolf Motor Function Test. In addition, the FMA was significantly more responsive than the Wolf Motor Function Test. Lastly, the FMA, compared to the Wolf Motor Function Test, was concluded to be better suited to assess arm function in individuals with subacute stroke due to better psychometric properties.